Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 20th of January. The basic picture is that we've got more COVID positive inpatients this week than we had last week. The numbers are steadily rising. So today we're showing 169 COVID positive inpatients. That's within 14 days of their first positive test. That compares with 152 last week and 135 the week before. We've got 130 patients in our general acute beds on the Blackpool site. We've got 20 in Clifton and 19 in intensive care beds. And just to talk about our intensive care generally, we normally have 16 intensive care beds and we've now escalated to having 32. We've got 16 allocated to COVID and 8 allocated to non-COVID, and have therefore had to move some clinical staff to staff those centres, and so have had to step down a certain amount of elective activity, but we're still really cracking on with that as best we can, so trying to manage the two pieces together. Occasionally across Lancashire we've needed to move patients from intensive care from one unit to another, for example from here to Preston or to Blackburn or in the other direction, to maintain capacity on the system, and those transfers are used in order to make sure that we've got capacity at every site across the county. I'm sorry to say I can see that we've had 22 deaths this week linked to COVID. So with COVID as a part of the death certification, either patients who've died of COVID or with COVID, we seem to be running at around about 20 to 25 per week. So my condolences go out to all the families who've been involved in that regard. I know what a difficult situation this is for everyone because of visiting and other arrangements and so on. Across the community, the figures are broadly flat actually compared to last week, but they're high. So Blackpool shows at 308 compared to 343 the week before, Fylde at 322 compared to 323, and Wyre a little bit lower actually at 381 compared to 444. So there's some good news and some bad news in that, isn't there? We're seeing a kind of levelling off, but the level is high. So you know, over the summer we were thinking about high being a number around about 100 per 100,000, and now we're talking about numbers of 300 per 100,000. So there's such a long way to go still to get those numbers back down into something that's going to be acceptable for all of us and allow us to come out of lockdown and to see a decrease in the number of really poorly patients that we're seeing coming into hospital. The good news bit of story is around immunisations. Within the hospital we've given over 7,000 now of the Pfizer-BioNTech vaccine, and colleagues in general practice and in pharmacies are ratcheting up their programmes. And of course I need to keep saying that you need to wait for something from your surgery to be called up onto the appropriate lists. They're working down the at-risk lists as we speak. We're now really rattling through NHS staff, having done a lot of people in the over 80s group and staff from care homes. And I'm pleased to say that our community teams have immunised all residents in care homes. Over 50% of those have been done now, so they're really working through the residential homes, and we're looking to complete that work in the very near future. And then looking forward, we expect to see a big site opening at the Winter Gardens in Blackpool to really ratchet up the mass immunisation programme. I shouldn't forget to mention flu. So if you've had a letter from your GP about being eligible for a flu jab and you haven't had one, please do have one. I think one of the worst things that could happen to us in the next few months would be to see COVID start to drop off and then suddenly have some surge in flu. So it'd be great if you could get that covered. And if you think you may have symptoms of a flu-like illness that could be COVID, then again, to reiterate, there is plenty of screening capacity now, so it's very easy to get a test by either dialing 119 or going on the NHS 111 website. Within the hospital, we are testing our staff using a process called LAMP screening, which involves a spit test rather than a swab test. And we're really pressing on with that program to make sure that all our staff are regularly tested, of course. And if there are any staff watching who have not yet enrolled on that program, I'd really encourage you to do that, please. And in our emergency department, we're introducing a new swab which gives a really fast turnaround time of around about 15 minutes. So we won't move patients from our emergency department until we know their COVID status. And by speeding up the turnaround time of the swabs, of course, we can move people through the department more quickly. Our ED department has been really busy because of, or at least in part because of, our need to restrict movement until we know people's COVID status. So again, if you've got a health problem which is urgent but not an emergency, please will you make contact with NHS 111 or go through your GP practice rather than coming straight to ED, because there's a risk of transmission if we have too many people coming to the centre. So finally, we're still not out of the woods yet, clearly. In some kind of plateau state, the numbers gradually increasing, but I'm rather hopeful we're going to see some levelling off there. The messages around hands, face, space still remain so important. We've just all got to keep going, I think, for the next few weeks. So thank you for sticking with it, and please stay safe to look after yourselves and your family and loved ones. Thank you.